So very good afternoon, everyone, all my friends, and I welcome all our esteemed speakers, guests, and all the delegates in this great event of MAPICON. I pay my gratitude towards organizing our worthy Dr. Vital Gupta and all his organizing team. And I really feel honored to be a part of this event of MAPICON 2021. So, dear friends, you can see my screen above. You can easily see. So many of you might have visited this place also. Many of you might be aware of this place. So this place is Golden Gate Bridge in San Francisco. But the sad part of the story is, of the scene is that it's a prime suicide site of the world too. The shoots of the movie Anjana Anjani was also done on this Golden Gate Bridge. So coming forward, now you might all be aware that I will be taking up this topic of suicide and the psychiatric aspects. So I myself is Dr. Poonam Bharti. I'm a professor in Maulana University and in the Department of Psychiatry. So welcome you all and following with my slides. So in this, I will be taking up the introduction with the various subheadings. All this is mentioned in my slide. So what do you mean by suicide? Suicide is derived from a Latin word, which is known as self-murder. Su means oneself, sidium is killing oneself. Now it is a fatal act which is deliberately initiated. It is performed with explicit and implicit evidence with a fatal outcome. So all these things are very important in this. So when a person commits a suicide is when there is a disparity between expectations and outcomes, when their real and imagined world is different. So at that time, during this disparity, a person goes into this problem. So going down the line, what if I talk about the historical aspects of the suicide, it has been already always condemned to the suicide. It was considered as a sin only. In ancient Athens, it was a person who committed a suicide, they were denied of normal burial. As well as in Rome also, it was whosoever came with the military defeat, it was an acceptable method for them. But in early 19th century in the Europe, it was considered that this suicide may be or it can be caused because of the mental illness. So all other Islam, Christianity, everybody said it is a sin. If we talk about in Hindu culture, the epidemic of suicide was seen when the Lord Shri Rama died and there was an epidemic of suicide. Otherwise, it is always condemned of suicide. A sati was also an example where the woman was used to immolate herself on the death of the husband, and that was also part of a suicide. Now coming forward, if I go to the statistical data on the suicide, I will be covering up the global scenario first, in which more than 8 lakh people annually die because of suicide. They commit a suicide, and one person commits suicide in every 40 seconds. It's a quite alarming rate. And the global suicidal burden, it has been increasing from 1.8 to 2.4. Among the adolescent age, it is the second most common cause of death. So, dear friends, you might be aware of, I told you the prime site of suicide, the Golden Gate Bridge of San Francisco. The suicide belt is including this area where there is the suicide rate is more than 25 per lakh population. It is Norway, Sweden, Switzerland, Germany, all these areas are included, regions are included. And Japan reports to have the highest suicide rate. Now this world data of 2017 reporting, India is having a suicide rate of 2.5 to 3%, whereas the Greenland is having the area suicide rate more than 4%. This WHO report of 2017 reports that the southern states of India also having a suicide rate more than 15%. Northern is having less than 3%. But overall in the world, the Southeast Asia have the highest suicide rate as compared to other areas of Asian countries. So Japan, I told you, having the highest rate. So even in Indian scenario, if you go for see the data, the men's, they have the highest suicide rate. It is 25.8% as compared to the females. The attempts are more in females, but the complete suicide is more in the males. So each year, passing year, there is an increase in the suicide rate, though suicide is very underreported many of the times. So if we talk about the states of India, the Kerala, Sikkim, Karnataka, they have the highest suicide rate. Now, if we know that the Kerala is having the highest suicide rate, then what they had, the steps which they had taken for, what happened in Kerala, it was known for the highest literacy rate, right? So, but they have worked upon their physical health, but there is a neglect in the mental health. So now they are they are starting with a CRISH program, which is prevention against the suicide and increasing the public awareness. Even at the MBBS levels, they are making this subject compulsory so that they can work in the high risk case crisis situation and can help out to prevent the suicide. This demographic is according to the gender. I told you females, they have more attempts, 3:1 ratio, whereas the complete suicide is more in the male is to female ratio, it is 4:1. Now in this state, I'm just concentrating on the two states, Punjab and Haryana. The Haryana is having the higher, double the suicide rate as compared to the Punjab. Now in this statewide distribution, I had seen the Arunachal Pradesh. This is having the highest suicide rate, whereas there is also a great fall in the suicide rate, which is seen in Daman and Diu during 2018 over the 2017. When the comparison was done, there was a great fall, means they had taken a corrective measures, they had worked upon the prevention and they are working upon it. Now I will be telling about a few stats about the job profile. Highest suicide rate is seen in farming and forestry as compared to the management portion. Then if there was a study where 1103 physicians were studied for who had committed, down the line they were studied, among which the surgeons outrated all the other professional doctors in this suicide also. Suicide was committed more by the surgeon as compared to other professionals. If we talk about juvenile suicide, the study was done in Japan. The suicide rate has almost doubled from 2016 to 2020. It's almost double. So there is an alarm on this. We want that we should take a preventive measures on controlling these. So if I talk about the various psychiatric disorders where the person commits a suicide, depression, highest. The person who is suffering from depression, depressive illness, they have high suicidal rate, followed by a substance abuser, and then followed by anxiety disorder or other disorders. Now, if I talk about suicide and homicide, the range from 10 years to 24 years, there the rate of suicide and homicide is almost parallel. But in the later decade, last year, above 55 years, the suicide outnumbers the homicide rate. Now I will be telling you there are various methods, suicidal methods, which are used by the various person who commits a suicide. So this is also different across the world. If I talk about Indian scenario, in India, even male and females, they use different methods to commit a suicide. In case of a male, men's hanging is the most commonly used. Whereas in the females, the organophosphorus poisoning or using overdose of the medication or other poisonous substance like phenyl and all these things, they are commonly used by the females. So hanging followed by poisoning and followed by other issues. These are the common methods which are commonly used for suicide. Now, the most important thing which I really wanted in the census of 2018, after the illness, the marriage-related issues, they create a lot of disturbance in a person, and a person, that is the most common cause which leads to the committing the suicide. A most vulnerable group, that is adolescent group. So suicide in adolescents is a big thing. One must take in consideration because they are highly vulnerable. They can go for repetitive suicidal attempts. The most common cause in adolescents for committing a suicide is bullying is the most important. and for even the physical and sexual abuse. Now the various terminologies which are very commonly used: copycat suicide. Copycat is peer group and publicized, model for the next suicide. Anniversary suicide. Anniversary, where the person takes their life on the same day as the member of their family did. Mass suicide. It's a Burari case of July 2018. Everybody might be aware of this. It was a huge, there was a death of 11 people of a same family member on the same day. So the word parasuicide is very commonly used along with the suicide. Parasuicide is deliberately self-harm. Here, again, the patient will do a willful, painful, inflictive, and destructive injuries act. But the wish, there will be no wish to die. It is just to release the anger. It is just to gain attention. So this type of parasuicide or acts, they are more common in females than as compared to males. Cyber suicide, very commonly these days, because it's also known as social suicide. They use the webcams, internet to record whole procedure, how they commit a suicide, how they are attempting the suicide, and their plans. They display all through the use of webcams. Now, I had covered the basic terminologies. Now, what is the etiology behind the suicide? Why the person commits a suicide? The sociological factors. Emil Durkheim, he was a French sociologist. He very well enumerated what are the different people, how they commit suicide, and what are the various reasons. Now, the psychological factors, the Freud gave this theory of melancholia. The severely depressed person can commit because of the negative cognitive distortions. If we talk about the biological factors, there is a fall in the serotonin level as well as its metabolite. And the dexamethasone suppression test, non-suppression of this is seen. Even there is a low level of cholesterol has been found in the attempters, suicidal attempters. Now, if we talk about genetic factors, there is a polymorphism at TPH gene, that is tryptophan hydroxylase enzyme gene. Now, I will be telling you, it's a very interesting how the Emil Durkheim reported about how the persons they chose why they chose to commit a suicide depends upon the person's own sociological factors. So he described the 4 different types of suicide. That was based on this wonderful diagram. I will let you know. This is the Durkheim's theory, which was reported. It depends upon 2 factors. Number 1 is the regulation, and number 2 is the integration. What do you mean by regulation? Regulation means the tight regulation which you use in your life situation. Supposedly, there is a huge regulation in your life towards any of the thing. It is fatalistic, means the fatalistic type of suicide will be there, supposedly in slavery or in prisoners. Anomic suicide. Anomic, when there is a too less regulation in your life, means you are exposed to sudden change in your life and you are not able to adapt and you opt for anomic suicide. Now, integration part. Integration is, now integration can be in 2 ways. It can be towards the society, you are highly integrated towards the society, leading to altruistic suicide. If you are integrated towards yourself, it will lead to egoistic suicide. Now, egoistic, you are integrated to self, no social support is there. Altruism, altruistic suicide was, the best example was the World Tower Trade Center example, where for a social norm, for someone else, you are committing a suicide for a sake of religion or for anything. Anomic is when there is a sudden and unexpected change in your situation and you are not able to handle that, you are not able to regularize that. Fatalistic, when there is a tight regulation, extreme rules are there and high expectation are there. Slavery is the best example I can give for the fatalistic suicide. Now, in a suicide, there are different types of suicide, I told you, but there should be a balance between a risk factor and a protective factors. Risk factor, as per, there should be trait dependent and state dependent. Trait, genetic, personality, what were the traumatic, your life events, what is the neurobiology you are carrying. And if we talk about the state dependent, it is the psychiatric disorders also. The patient, I gave you a graph where the depressive patients were more who committed a suicide, followed by substance user. Now, protective factor is when you have a strong connections, when you have a skills to solve some problem. Conflict resolution is there, belief which discourages the suicide, and you're always ready to go for a mental health therapist and physical for your illness, any type of physical or mental illness. Now comes the role of a psychiatrist in a suicide. Now, what is the role? It's though we know that it is a complex phenomena and also it is having a devastating effect. Now, psychiatrists can acknowledge your pain and suffering and help you to form. Now, the 10th September, it is a Suicide Prevention Day. Now, how a psychiatrist will work upon? Can we assess any person's suicidal intent? Very right. Yes, we can. So how we can do? We can do through evaluation, through the various tools available and the warning signs which we have. Now, as a psychiatrist, as a therapist, I would love to go for an interview, which should be in a sensitive manner. I should start with the passive thoughts. Then I must proceed towards the active thought a person is having. And how I should not be a judgmental towards the patient's current situation. It should be according to the interest of the patient and safety of a patient. Whether I should plan for an indoor treatment or an outdoor treatment for a patient. Now, dear friends, I will be exchanging these slides with you all. There are a lot many tools which are available for the assessment of the suicide. We can go through it, just take 5 to 10 minutes. Now, we have evaluated various tools. Even we can evaluate the suicidal risk factors also. The risk is a person having high risk must be taken in consideration over the age of 45, male, widow, unemployed, and lot of chronic illness or the suffering from lot many physical illness. Along with the suicidal activities, whether there is a past history of multiple attempts, frequent, and all those things. Even who have the poor insight that and poor achievers in their life, so socially isolated, so they are at high risk of committing suicide. So evaluation is important. Second is the warning sign. They can be verbal and they can be behavioral. If I talk about a verbal sign, supposedly many of the students or the persons who are about to commit a suicide, they will say, I don't want to live. Nobody cares for me. I won't need anyone else anymore. So verbal sign, behavioral signs can be a person is gathering some lethal weapons, or there is a sudden change in a person's behavior and there is a feeling of hopelessness and making the final arrangements like closing the bank accounts, making wills and all that, giving away the prized possessions. So many of the time with the suicide, we get a suicide note. 90% in the suicide note, there is an apology, shame or guilt written. So now we have to do about the prevention. How can we have evaluated, we have found out that the person is high risk or not. Now we have to do the prevention. In a prevention, there was a WHO has reported that into 2012 that it should be multi-sectoral and systematic and strategic approach must be taken. For population awareness, we will go for a community level, institutional level, community public awareness. Guidelines for the mass media should be set up. Even for the sale and purchase of pesticides and over-the-counter medication must be taken under control. On institutional and organization level, the high-risk setting, how to manage a crisis intervention, the various programs for training the students to take care of this high-risk problems and redesigning the curriculum at the MBBS and nursing and medical levels. High-risk people are who? Those who attempt again and again suicide, children at school, prisoners, or the patients who are already suffering from some psychiatric disorder. This was the approach, a strategic approach for the suicide prevention, which was taken up by WHO, that is Live Life. So these are the various helpline agencies which are available in India. A person can give a call where they need, when they are in a critical situation, they can go and they can have a call over there before committing a suicide. So this must be distributed among all. Now, most important, ensure the patient's safety, develop a rapport and find out what are the previous records, and you have to manage the patient. Now, dear friends, I want to ask, when a patient with a suicidal attempt comes to emergency, what are the various procedures we need to follow? History of an attempt, admission and MLC registration should be done. The prior most important is stabilize the patient and inform the patient regarding the section 115 under Mental Health Act. Then doing the psychiatric referral and following with the psychiatrist therapist after the patient is medically stable. Now, what you will do if you encounter sometimes inpatient suicide, the steps which you should take, you must follow some that standard operating procedures. Must immediately inform your supervisor. Always contact a trusted colleague who can give you formal and informal support regarding this. If possible, you must attend the patient's funeral, because it is not a non-natural death. It was a suicide committed inside the hospital. So participate in audit process. That is very important. What went wrong? Could something have been done differently? Now, how you will take a measures with your staff also. Make staff aware of the death. Avoid blaming. There should not be a blame game starting because of this. This happened because of this. This thing happened. Be available with the staff and maintain the schedule. It should not be like a person has committed a suicide and now the other persons in the ward, they are not taken care, because whole attention is fixed on that. You have to, so reshifting and rescheduling of the work should be done. The other patients must not suffer because of this. Most important is psychological autopsy exercise is very important, in which you can emphasize the new learning experiences. Focus on improvement, how you can formulate the policy reforms for better care. Now, most important, you can also take few steps for the patient's family also. You can preferably within 24 hours, you can contact them, you can express your grief, give the family an opportunity to ask few questions. Even when you speak to the family members, emphasize that all realistic efforts were made by you people and you really held out, but it was really an unnatural death. Now, if I talk about the management part of a suicide, now there are two plans, indoor and outdoor. According to the patient's condition and safety, take it that you have assessed it. If the patient really needs an indoor admission, admit the patient. If you feel a patient can be treated on the outdoor patient's basis with a good social support, which can be seen frequently, and with prescribing those medications which have the fewer side effects and in a smaller quantities. In the case of treatment, we have two parameters, non-pharmacological and pharmacological. So various therapies should be interventions must be taken in consideration during the treatment of the patient. Now, the psychotherapy, whatever you choose, must be according to the patient's underlying issues. How effective that therapy will be according to the person's personality. For example, a borderline personality disorder who comes with the again and again attempts of suicide. You can even start with a medication, and also you can start with a behavioral therapy, that is dialectic behavior therapy. So there are various psychotherapies which are available according to the patient's condition and situation you can start with. Now, the most important dialectic behavior therapy, which is used in the suicidal patients, I will be telling you a brief about it. These are in the chronically self-injurious patients who are coming again and again with the parasuicide and with the deliberate self-harm. There, this therapy works. So what happens exactly? Whenever there is a stress in your life, there is emotional dysregulation, which leads to problem behavior. So now how a dialectic behavior therapy will help you out is, whenever there is a stress, there is an emotional dysregulation. Now the DBT will teach you how to tolerate that distress, not to leading to abnormal behavior. When that DBT will also teach you, stop that behavior, don't do that behavior. If okay, there is an emotional disturbance, which is common with everyone, so don't do that behavior. When that behavior is cut down, this will also reduce the reinforcement of which it was like the behavior was occurring again and again. So with this dialectic behavior therapy, you are able to control, regulate the behavior of a person, and you will stop them for doing the self-injurious acts. As we all has gone through basic life support and advanced life support, there is also 5 steps in healing as an emotional pain. Ask for them, keep them safe, be there, connect with them, and always stay in touch with them. If they are able to, there are various helplines available which one can do. So a few aspects which 2 slides which I really want to comment upon is the suicide and the law aspect. The IPC 309 is taken in consideration whenever there is a suicide case. So according to which it states, whosoever attempt to commit a suicide or does any act towards the commission of this offense shall be punished or imprisoned for 1 year, or both can be done. So this was this. But now there has been a decriminalization of the suicide under the Mental Health Act, which states that 309, there is a punishable act. Now according to Mental Health Act, section 115, notwithstanding anything with the 309, it states that anyone who attempts the suicide should be presumed, unless proven otherwise, that that person is suffering from severe stress and shall not be tried and punished under the said code. So this is legal dichotomy is seen. Very important, euthanasia. Everybody might be aware of this term, euthanasia, wishful to die. There are various types of euthanasia. Euthanasia is the person is having a wish to die. And everybody might have seen this movie also, Guzarish, where the Hrithik Roshan really wanted that he had a wish that he don't want to continue his life. His own will was there and he wanted to die. So the euthanasia is active and passive. Active means this is act of death is when a death is brought by an act with a high consumption of high dose of drugs. A person actively uses that drugs. Passively, when we omit something like the withdrawing some treatment, person needs some machine, holding a surgery which will help off. And so those things are omitted. It is passive euthanasia. Voluntary and non-voluntary. Voluntary means it is committed by person's own will. Non-voluntary, where the person is not able to give his own consent. So somebody else comes and take that consent, that okay with it, we can proceed for euthanasia. So usually it is also called as a murder. But the difference is that here it is for the favor of the patient. This thing is considered that it is for the favor of the patient. Indirect and assisted suicide is also there. Indirect is when the person is taking some medication, person knows that because of this side effect, my life will be shortened. Still the person is accepted. No, I want to take. Assisted suicide, a person really wants other person's help to proclaim that drugs or medicines and really want to shorten the life. So these are the various different type of euthanasias. Lethal injection, the US government approved this instead of humane alternative to the electric chair which was used. In this lethal injection, 3 types of drugs are given. Where is this thiopenton, pancuranium to stop the breathing, and injection of potassium chloride to stop the heart instantaneously. So dear friends, I would like to highlight a few more slides of iconic faces who had committed a suicide. Sushant Singh Rajput. He was 34 years old. He was found hanging from and it was also found that he was suffering from some depression. Next is Divya Bharti. Everybody knows that she jumped from the home 5th story building and she also committed suicide. Jia Khan was found hanging in 2013 and it was according to the reports that she was also depressed and had some relationship issues. There are other popular persons who you may be aware of in Balika Vadhu also. So this picture, if anybody sees, you will see how jolly this person is. He was Robin Williams. He was the best comedian, and he was under alcohol dependence and severe depression, and he also committed suicide by hanging himself. This Punjabi actor was also there. He was also committed suicide. Marilyn, she also committed suicide by taking overdose of barbiturates. She was also having depressive episodes and mood disorders. So dear friends, there I told you a lot, many iconic figures. You might be knowing many more even. So they use different methods to commit a suicide, and they took a life. And there are n number of, now this screen is showing n number of doctors even. They had the postgraduate students and the physicians and the doctors, they had taken their life even. So steps must be taken. It must be, a suicide is a burning topic. It must be taken in, preventive measures must be taken so that we can prevent the life of a person. Few facts and myths about the suicide I would like to tell you. This is my these will be my last slides, in which myths is, when someone is suicidal, he or she will always remain suicidal. It is taken in consideration. No, dear friends, it's not like that. A person when commits a suicide, at that time a person can have an impulsive act. He or she does not want to commit a suicide. So there may be a suicidal attempt further also in their life, but many of the times they can live a long, healthy life. Now, second myth is, talking about a suicide is a bad idea. It can be taken as encouragement. Suppose I talk about suicide with some other person, that may be an encouragement to do. It's a no. The fact is that sometimes a person who is having a suicidal ideations, that person doesn't know to whom he or she should talk with. Talk with that person openly. Maybe you give another options to think about, to rethink about his decision, and you can prevent a suicide. Sometimes it is taken that the persons who attempt suicide, they are just attention seekers. It's not like that. Sometimes these suicide, they happen without a warning sign also. Sometimes you have a warning sign. I told you the verbal and behavioral warning signs. Sometimes few suicides, they are just without any warning signs. It's not always an attention seeking. So people who talk about suicide don't mean to it, means who they just talk about it. No, maybe the fact is they are crying out, they really want your help and support, because there may be an underlying psychiatric illness or an issue they are suffering from, and they don't know to whom they should address with, they should talk with. So they are just crying for their help and support. So someone who is suicidal, determined to take the life, it is not like that. It is, a person is always ambivalent whether he should continue his life or he should be commit suicide. He's ambivalent. He is not determined to die. And sometimes it is just out of anger, out of impulse, the person takes poisoning, pesticides, or they just try to do deliberate self-harms. They are always ambivalent. So be helpful to them. Now, this is also seen that certain people are at risk. They are always suffering from a mental disorder. It come across us that the persons, they are suffering from with the mental disorders, they are always suicidal. It is not like this. The fact is, though, when a person does this deliberate self-harm, there is always a deep sense of unhappiness is there. I understand. Everybody should understand that also. So it is that people with the mental disorders may not be having a suicidal ideation. And even the persons who committed the suicide or who did that deliberate self-harm may not be suffering from any psychiatric illness. So it is a both way. There can be a psychiatric illness also. As I told you, many depressive persons, they commit to suicide, but it is not always 100%, right? So dear friends, my take home points for this lecture is, suicide is preventable. The key is multi-sectorial approach. The media, mass media, the government, as well as the society, the people, we all should integrate together, and we should work upon it for the effective prevention of the suicide. as the mental health, WHO always wanted the mental health action plan from 2013 to 2020 was that there should be a 10% reduction in the suicide rate. So my take home points is suicide is preventable. It's a complex phenomena, and we should overtake the myths also, which are hovering all around. We should handle them with the proper facts. Prevention policy must be taken with an integrated approach. I told you the dichotomy in the law also, decriminalization of the suicide. Interventions must be taken towards the prevention part. Better to talk rather than to repent afterwards. So suicide is not the just to, we are passing on that pain to our family member. It will not end up with the pain. So these were my references, and I extremely thank you all for your patience listening in my whole presentation. Stay safe, stay healthy. Goodbye to all. Thank you.